You're watching ASH News TV. I'm Ed Hyland.
And I'm Rachel Kopchak. The 60th ASH annual meeting and exposition is where you hear it first when it comes to groundbreaking research in hematology.
Let's see what's hot off the 2018 ASH presses. CAR T-cell therapies have quickly shifted the treatment paradigm for patients, with several types of aggressive blood cancers increasing chances of survival. However, these therapies do come with limitations in the bone marrow transplant world.
The retrospective analysis that we have done thus far, there's suggestion that if patients don't have a history of a transplant, they really do benefit from a transplant following attainment of remission from the CAR T-cell infusion on our Plateau 2 trial. Additionally, subjects that lose their CAR T-cell persistence shortly after infusion really do seem to benefit, as there is an increased risk of relapse following loss of the CAR T-cell persistence.
The science evolved to a point of where we have these amazing therapeutics that can change people's lives, but our payment system has nowhere evolved to be able to manage or reimburse at a level that's sustainable for these institutions. So it's paradoxical that you have institutions at the vanguard of delivering innovative therapies that are also kind of being penalized by the absence of a sustainable payment system.
4 big trials yield 4 big results on new treatment options for both malignant and non-malignant blood disorders. One study reveals the benefits of reducing the number of cycles of chemotherapy for treating patients with diffuse large B-cell lymphoma. A second study compares several drug combinations for treating older patients with chronic lymphocytic leukemia. And a pair of separate studies suggest the experimental drug luspatercept can help improve red blood cell production, reducing the need for transfusions in patients with anemia.
In a randomized trial in MDS, Medalist, luspatercept was superior to placebo in patients with ring sideroblasts who had not previously responded to or were ineligible for treatment with erythropoiesis-stimulating agents. And in thalassemia, luspatercept reduced transfusion needs in adult patients with beta thalassemia who were requiring regular transfusions compared to placebo, with quite a benign safety profile.
For individuals living with sickle cell disease, new research findings could expand access to both curative and supportive treatments worldwide. 2 first-in-human trials show promising initial results for groundbreaking approaches to stem cell transplantation and gene therapy for SCD. By manipulating cells, researchers hope they can expand the pool of potential bone marrow donors.
There are some things that are useful in terms of what we have learned about mobilization of sickle cell donors and how we can ablate the marrow so that rejection isn't a problem. These are things that can be helpful to the gene editing people. So I do think there's going to be some crosstalk, but obviously we want to look at all options that can ultimately result in the curative therapy of this horrific disease.